Hello and welcome to a Journal Club review of the SURMOUNT-5 clinical trial. My name is Bharati Bhardwaja, and I am the rheumatology clinical pharmacist for Kaiser Permanente Colorado. So let's kick things off with a high-level overview of this clinical trial comparing tirzepatide to semaglutide for the treatment of obesity. It was designed as a Phase 3b multi-center open-label parallel arm randomized controlled trial. The purpose of the study was to evaluate the safety and efficacy of tirzepatide as compared with semaglutide in adults with obesity when without type 2 diabetes. Here we have an overview of the study methods and outcomes. The duration of the study was 72 weeks and included 751 participants randomized in a 1:1 ratio to receive a maximum tolerated dose of tirzepatide at either 10 or 15 milligrams weekly or semaglutide at 1.7 milligrams or 2.4 milligrams once weekly. The primary endpoint was a % change from baseline in body weight at 72 weeks, and highlighting key secondary endpoints here that include body weight reduction from baseline and the change in baseline in waist circumference at 72 weeks. The baseline demographics and clinical characteristics of the study participants are displayed here. The mean age was about 45 years, majority were female and white, and many had long-lasting obesity with an average duration of about 16 years and an average BMI near 40, and many had multiple obesity-related complications. Moving on to the results, and for the primary outcome for % change in body weight at 72 weeks, as displayed here in the chart, we see that for the tirzepatide group had a mean body weight reduction of 20.2% from baseline compared to semaglutide, which had a mean reduction of 13.7%. Tirzepatide was found to be superior to semaglutide with a 6.5% difference in body weight reduction, which was statistically significant. Moving on to the key secondary endpoint of % of participants achieving body weight reduction targets is displayed here in this chart. A greater number of participants treated in the tirzepatide group had reductions in body weight of at least 10%, 15%, 20%, and 25% from baseline compared to those treated with semaglutide, and this was statistically significant. And lastly, looking at an exploratory endpoint of at least 30% reduction in body weight, which was observed in 19.7% of participants in the tirzepatide group compared to 6.9% in the semaglutide group, showing an almost threefold likelihood increase of achieving this weight reduction with tirzepatide as compared to semaglutide. And lastly, for the key secondary endpoint of change from baseline in waist circumference at 72 weeks, as displayed in the chart here, we see that tirzepatide was superior to semaglutide with a 5.4 centimeter reduction in waist circumference, which was statistically significant. And finally, looking at safety outcomes, the most frequently reported adverse drug events were GI-related and included nausea, constipation, diarrhea, and vomiting, with the severity increasing during dose escalations. Injection site reactions were more common in the tirzepatide group, and serious adverse drug events were reported overall in 4.1% of study participants. So in summary, over the 72 weeks, tirzepatide was statistically and clinically superior to semaglutide for weight reduction and waist circumference. Tirzepatide was statistically and clinically superior for all key secondary endpoints, and the overall safety profile for tirzepatide and semaglutide are consistent with the known safety profile of each drug. And this concludes the review of the SURMOUNT-5 clinical trial. Thank you for listening, and for more educational content, feel free to visit online at the WRAP Content Room, or you can access it through the WRAP ACE app. Thank you.